Hello, everyone. Welcome. I'm just going to see if there's a few more people waiting, and then we'll get started. Great. Hello, everyone. Thanks for being here. We're here for our third community forum for veteran oral health care, and we're focusing on improving oral health through collaborative action in Iowa. Next slide. A few housekeeping pieces. We are recording this session, and we'll have the recording available afterwards on our website, along with the slides and other materials. Please chat and engage throughout. This is a community forum, and by that, we want to hear from you, as well as sharing the data that we have found through our research. So please share your information in the chat, say hello, and I hope that you stay engaged throughout our time here today. CEUs are available for the session, and we will provide the evaluation and request link at the end of this session. These are our learning objectives here today. These were provided in the registration information and are attached to our CEUs. Our presenters do not have any disclosures to share today. And I'm going to hand it over to Liz here shortly, our Executive Director of Education and Leadership here at the AIDPH. And she's going to be talking about the state of veteran oral health in Iowa and give an overview of the research that we've done there, and then specifically dive into identifying collaborative action opportunities for Iowa stakeholders. And most importantly, again, we want to hear from all of you on how we can leverage this report for collective action. So throughout Liz's presentation, we're going to have several opportunities to pause for discussion, chat, as well as some polls and other opportunities to hear from you and your thoughts. So without further ado, I'll hand it over to Liz.
Thanks, Sam, and welcome everyone. Thank you again for being with us here today. We're thrilled to be on this community forum. And with that being said, we can go to the next slide and talk about what is a community forum? Why are we here today? So we'll have a bit of a didactic presentation going through the report that we've done on veteran oral health in Iowa. But really the purpose of having this session and going through that information is hearing from all of you, the stakeholders in Iowa working in veteran oral health and dental public health. So as Sam had said, we have several pieces. We have polls, we have comments to put in the chat, and pieces where we want to engage in discussion with you. So please be primed and ready for those pieces and ready to share your thoughts. It's an important part of this, moving through next steps and making this data usable. So we can head to the next slide. I'm going to start off a little bit talking about AIDPH. Our mission is empowering our community to advance oral health through science, education, and advocacy. That's what we're doing here today. We're taking research and data that our science team did and putting it together in an educational program and talking about how we can educate the community and take advocacy steps, et cetera, with that. We're doing this work towards a justice-oriented oral health system, which is our vision. We can go to the next slide. At AIDPH, we have 4 communities of focus. Those include LGBTQIA+, people, veterans, disabilities, and rural people with disabilities, and people living in rural communities. And we understand also that there's intersectionality between these communities. And like we're talking here today, we'll see that there's a lot of intersection, particularly with veterans and rurality, veterans and disability. We can go to the next slide. This is a graphic showing a little bit more about the programming we do here at AIDPH. Again, I'm the Director of Education and Leadership here, and this is just showing the variety of educational programmings we have. We really aim to have a diverse set of offerings so that all professionals have something that works for them and their schedule and their level of engagement. You can learn more about that on our website or ask me any questions if you have them. We can go to the next slide. We want to highlight here again, we're diving deep into the report we did on veteran oral health in Iowa and talking about specifically collaborative action we can take there. But the main point here is this isn't a standalone report. We worked really hard to make the report visually engaging. We're doing these sessions here to engage in a different way to hear community voices. And we have the information in a dedicated space on our website with additional tools such as an interactive dashboard. So really want to highlight that we're looking to make this information usable and accessible. We encourage you to take a look. And if you have questions or upgrades, please let us know. We can head to the next slide. So the state of veteran oral health in Iowa. I'm going to talk a little bit to get us started about the report, how we developed that, and how it came to be. So we can head to the next slide. And as we do that, this is our first little moment of discussion here. We want to hear from you about what comes to mind when you hear the phrase collaborative action or collective action. So if you can pop that in the chat, Sam will be taking a look at that, and we'll chime in to share some of that in a moment. I also encourage you, if you have examples of collaborative action you've taken for oral health care or veteran oral health care, let us know those pieces as well. Okay, and as you're working on that, I'm going to move on to talking a little bit about our report. We can head to the next slide. So keep thinking, keep putting that in the chat, and I'll talk a little bit about how this report was developed. So AIDPH was funded by Delta Dental of Iowa, and we want to highlight them and thank them for making this project possible. To develop this report on veteran oral health, we went through a rigorous process of identifying data. We did some data collection through qualitative interviews, and then also developing this really comprehensive report. So I hope, Sam, you want to chime in with some thoughts?
Yeah, we've got a
Okay,
couple
great.
responses. Edith said when she hears about collaborative action, she thinks it's working together to meet our mutual goals. Mary Kelly also chimed in with multiple entities working together for common goals. So we're all on the same page.
All right, great, wonderful. Well, hopefully we can talk about some more specific ways that can happen, and potentially brainstorm some pathways for that in Iowa during our time here today. So with this report, I hope everyone's had the ability to take a look. We can share the link in the chat to this. I believe Sam sent it out ahead of this session. It's very long, it's 74 pages. We compiled all of the findings and designed it in a way, our goal there was so that it would be really visually compelling and digestible given how comprehensive it was, both for folks to understand what was included there, but also so that you can take that report and use it with decision makers, stakeholders when you're doing your different programs and work towards advancing veteran oral health. So the report was released this January, and since then we've been working on amplifying the findings. Again, that's why we're here today, recognizing that it's such a large report, really taking some time to chunk out some of the specifics, dive into it a little deeper, and hear from you, the community, questions you have about it or upgrades as how it's working for you on the ground. We can go to the next slide. So with this report, we really wanted to understand 4 different things, which was how do outcomes differ in Iowa between veterans and non-veterans? Also, what factors are contributing to poor oral health outcomes among veterans in Iowa? What opportunities exist for improving those outcomes? And then lastly, and possibly most importantly, what can we do? What steps can be taken to impact and influence the outcomes that we're seeing? And that's what we're talking about here today, digging into a little more of those strategic recommendations, again, specifically how we can work with collaborative action to make those happen. So we can head to the next slide. So this report started with a literature review, and we did that because we really wanted to understand what had already been published around veterans in Iowa and their oral health and their overall health. And that enabled us to orient ourselves to what veteran oral health is and what it looks like in Iowa. And from there, we gathered quantitative data. We analyzed those data. For our quantitative analysis, we predominantly worked within the Behavioral Risk Factor Surveillance System, or BRFIS, and a couple other data sets are represented in the report as well. And then the third aspect of what we did was stakeholder interviews. And in approaching the interviews, we cast a wide net to get an understanding from providers and patients and veterans about what their experiences were with oral health in Iowa. And then last, we took all of those things and developed strategic recommendations by stakeholder to improve veteran oral health in Iowa. So talking a little bit more about the different elements of the report and how they can be used. If you've taken a look at the report, you've probably seen it's comprehensive, it's technical, but still visually engaging. We have an executive summary, actually two. One's about 7 pages. It's a little bit longer, a little bit more information. And then we have a 2-page high-level overview executive summary. And again, we did that because we wanted it to be very usable for people's different purposes and the different programs and work you're doing on the ground. And then again, as I referenced before on the website, we also have a data dashboard that allows you to engage with the data online. So we can go to the next slide and look at the specific sections of the report. Today, we're going to highlight sections 2, 3, and 6. At our last community forum, we talked about integrated care, and we're really going to build on that discussion. We'll again review the oral health pieces and the overall health pieces and talk through collaborative action opportunities to address the issues in veteran oral health and overall health, and how we can integrate collaborative action into our daily work. We can go to the next slide. So this report was designed for a series of stakeholders, and to that end, we're really interested in knowing among who's here today, the target audience which you identify with. So we're going to pause and hear from you by launching another poll. And as Sam does that, I'll let her launch that and give you all some time to answer that. She'll let me know when she's ready to share the results.
Okay, the poll is launched. I'm just waiting for results.
Okay, perfect. Let me know. So we talked to these stakeholders in our report and calling attention to use cases under each one of these target audiences. And again, we created strategic recommendations based on the target audiences with the intention of having this be a very usable report. Okay, are you ready to read, or should we give it another minute?
Yep, we're there. We've got, let's see, 43% clinicians, 14% association, 29% researcher, and 43% insurance.
Okay, wonderful. Thank you everyone for taking time to share that. That gives us a great sense of who's here with us today and how these pieces might be applicable to you. And also for folks to understand who's joining them as we're talking about different partnerships and the collaborative action piece. Okay, so we can go to the next slide. And we're going to talk about the infrastructure in Iowa. We covered some of the infrastructure pieces on our last community forum, but again, because we cover a lot of ground in this report, there's more than we could talk about in one session. So I'm going to start with some level setting pieces that might be a bit of a review for folks who are in this work or who were on our last community forum, but then we're going to move into some more of the details about infrastructure that we haven't discussed yet. Okay, so we do a fair amount of work with veteran oral health, both through this program and other sessions that we do. And we really like to always just kind of start with the numbers and eligibility and what that looks like. Because what we find is that there's often a lack of understanding of the fact that most veterans are not receiving dental care through the VA. So looking at this chart, we see that there's about 18 million veterans in the US. About half of that population are receiving health care from the VA. Of those that are receiving health care at the VA, only about under 2 million are eligible for dental care from the VA. And then we see of that less than 2 million that are eligible, there's only about a third of them are actually utilizing that care. So what that means is ultimately most of the veterans in the US are not getting dental care at the VA. And what that can mean as a stakeholder in Iowa is that if you're a private practice clinician, someone working at an FQHC, basically anyone providing clinical services outside of the VA, you are far more likely to be caring for a veteran. You can go to the next slide and take a look at this map. It's showing us the infrastructure of VA clinic locations and the types in Iowa. So thinking through where veterans are getting their care, that answer is really complicated. We know that there's only 2 VA dental clinics in Iowa. So veterans who might be living in a more rural area or more rural county, if they're eligible, they are having to travel longer distances, if they're able to travel those distances to be able to get to a VA dental clinic. And if we go to the next slide, we contrast that location of where VA clinics are to this map, which is showing us the percentage of veterans in the adult population by county. And what we're going to do on our next slide is do a slide-by-slide comparison. So what we're seeing here is that the map of the VA clinics and the types of clinics compared to the percentages of veterans in the adult population by county, as well as a map that shows the federal dental healthcare shortage designations. So really, this is a quick snapshot on your computer, but this is where I would encourage you to go back to the report and take a look at how these maps compare specific to you and where you're doing your work, and seeing how the data applies specifically to your location in your everyday work. I think we can really see where there's an overlap of gaps if those shortage areas are aligning with high veteran population rates, if those high population rates aren't aligning with the VA dental clinics, those pieces. And it can give an understanding of your work and your population that you're working with. Okay, we can go to the next slide. Another piece in the infrastructure section that the report details are social determinants, such as education and income levels that impact oral health access and outcomes. So I want to highlight a few here specific to veterans. So we see that nearly a quarter of Iowa veterans have a service-connected disability rating. That gives us a sense of the healthcare that they might be in need of. And about 22,000 Iowa veterans are living in homes with one or more major problems of quality, crowding, and cost. Connected to that, we see that about 19% of Iowa veterans pay too much for their housing. So those pieces together can really indicate that housing insecurity may be a systemic issue among population. And the reason that we're highlighting this particular part of the infrastructure today is to kind of give that idea of the different types of agencies or service providers that are relevant to work with and make partnerships with as we're moving forward on programming and thinking through partnerships. We can head to the next slide. So what do we know overall about Iowa veterans? We know that veterans in Iowa are disproportionately white, male, and residents of rural areas. We know that Iowa veterans are experiencing poverty and housing insecurity at higher rates than non-veterans in Iowa. And geographically, Iowa veterans are highly concentrated in rural areas. And additionally, veterans are also more likely to live in a health professional shortage. We can go to the next slide, and we're taking a look at what we know about the overall healthcare access and care delivery for Iowa veterans. So we see that most of the dental healthcare access points in Iowa for veterans are located in urban areas, so if we're seeing most of our veterans located in rural areas, but the care is accessed in urban areas, we see that access problem there. We also know that veterans are underinsured or do not have employer-paid dental coverage. Dental care coverage for many Iowa veterans is limited to Medicaid, VA, and charitable programs. And we also know through doing this work that the data is limited. So there's a lack of veteran status indicators collected within healthcare systems. So the full scope of veteran access within the current infrastructure is difficult to determine. So that can be a place where we can see next steps and research need there, or data collection need. We can head to the next slide. So all of that being said, we just took a look and talked about what our veterans are facing, about rurality. There's a lack of eligibility or dental care coverage, housing insecurity. So all of that being said, we want to hear from you about what other complicating factors are you seeing that impact veteran oral health in Iowa, either from your personal experience or in your work. Is it reflective of those pieces that we just talked about? Again, the rurality, lack of eligibility or dental care coverage, housing insecurity, or are there other pieces that you're seeing as well that are complicating factors? So I will let you all take a minute and process that and post in the chat. Yes, trauma-informed care. Thank you, JC. That's something that we see come up repeatedly. We will go into an oral health overview, and Sam, I'll have you chime in as folks are writing in the chat. Christine, oh, perfect. Thank you. So now that we've taken a look at the infrastructure, I'm going to give an overview of oral health for Iowa veterans, highlighting four main factors here. So we see that veterans in Iowa see the dentist less frequently. We know that tooth loss is higher among veterans in Iowa. Veterans face transportation barriers, which we've seen in what we talked about as well as in the chat. And veterans are struggling to afford pay for oral health care.
Hey,
Sam?
yeah, I'll interrupt you there. We've got some good
Perfect.
answers as well. Yeah, workforce, huge issue. And oral health literacy by Carol. Both great responses.
Yes, thank you. And actually, that healthcare literacy was something that we saw reflected in our stakeholder interviews as well. And it's a piece we're going to talk about when we talk about potential collaborative action pathways. So that's great. Thank you for sharing that. Okay. All right, so this chart here, we're looking at oral healthcare utilization, and looking at this graph, we see veterans in navy blue and non-veterans are represented in lime green. And what we can see here is when we're looking at seeing a dentist in the past year, the veterans are at a lower percentage. And as we move on this graph from left to right, and that time increases, the percentage of veterans goes up. So that is kind of showing us an access and a utilization piece. And we can go to the next slide. And again, looking at the graph on the left here, veterans are in navy blue with non-veterans in green. And when we're looking at tooth loss and at the none to low numbers on tooth loss, we see that the veteran percentage is lower than non-veterans. But then when we're moving again to the left all the way over to full indentialism, we're seeing that that veteran percentage is higher than the non-veterans until we get to 10% of veterans versus 4% of non-veterans when we're looking at full tooth loss. And then if we look at the chart over to the right, we're looking at rural veterans versus urban veterans. And again, we're seeing a similar pattern here when we compare rural veterans to urban veterans, with those outcomes being worse for rural veterans. The rural veterans are represented in dark purple. And when you're looking at no tooth loss, we see that rural veterans that are a lower percentage, and then we move into the higher percentages, looking at one tooth loss to all. Those rural veterans are higher than urban veterans. We can head to the next slide. And this is some pieces from our stakeholders. Again, that transportation that's been reflected in the feedback from y'all in this report. And this is just highlighting this from a stakeholder talking about the veterans they work with, saying it's been a challenge for a lot of our veterans, particularly in the rural areas, but even here in this county, we have really good quality providers here, but just to get that veteran to those additional places has been difficult sometimes. And it can be a long time frame. So I want to highlight this when we're talking about transportation. That's something we see and hear in our work over and over again with our veteran work, with our rural work. And I just want to highlight that transportation barriers can be many things. So this sounds like it's someone in an urban county talking about transportation still being an issue. And that can be, if we're talking about veterans, disability can be a compounding factor there that impacts that. It's not just those long travel times or lack of access to a care. Different urban areas might lack public transportation. So when you're working on transportation and thinking about that in your community, I encourage you to think outside of the box and understand what the specifics there are. And we'll talk a little bit about that too, about why that's so important to engage the community and engage veterans in the work we're doing and hear from them about the barriers, because it can really provide more specific solutions that speak to the nuance of the problem. We can go to the next slide. So again, we're looking at affordability here, and this person is saying affordability is a key issue. Cost for a lot of veterans, really most of the veterans that we have worked with, it's been many years since they've had dental care, predominantly due to cost. Cost is a big factor. So again, this is just a firsthand experience of how much a barrier cost is and being unable to pay for that care. We can head to the next slide. And so again, wanting to hear from all of you, want to know of these barriers that we just listed, which have you seen the most in your work and is reflected of the work you're doing?
Okay, the poll has been launched. No responses yet.
Okay, great. Anything else to highlight from the chat, Sam, before I move on and let folks? Okay, great. I will also say if you have a question and we haven't prompted for the chat, please chime in with those. We're happy to pause and discuss or go back or move on with a question, even if it might not be on track.
All right,
Okay.
I think we've got all of our poll answers. So I will end the poll. It looks like it's 50-50 split, transportation barriers slash access issues and the inability to pay and lack of insurance.
Okay.
What people are seeing, yeah.
Thank you, everyone, for sharing. That's interesting that we have a 50-50 split here. It's great insights. Okay. So looking at our next slide, what do we know about the oral health and well-being of Iowa veterans? Unfortunately, we see that Iowa veterans have worse oral health. Most oral health indicators show that Iowa veterans have poor oral health outcomes. Indicators such as income, education, and age exacerbate those, but what exacerbates it the most is rurality. And some veterans visit a dentist at similar frequency to non-veterans, but that large disparity in outcomes, such as indentualism, suggest that optimal oral health isn't being achieved even if those visits are happening. We can head to the next slide. Okay, so we're going to talk again a little bit about physical health. And I noted at the beginning of this presentation that we would build on our discussion from the last community forum around integrated care because it leads into our topic for today, collaborative action. And when we're looking at the intersection of oral health and overall health, we see many opportunities for collaborative action. So with that note, we're going to do a quick review of how Iowa veterans are experiencing overall health and well-being. And we covered some pieces of this in our last community forum, but again, are diving into some different pieces as well, given the complexity of the report and looking at some new pieces here. So understanding the interconnection between oral health and overall health, we really want to understand what the physical health of veterans looks like. So through the report, we examined data around physical health indicators and oral health indicators. And this is important because we know certain pieces of our physical health and overall health can exacerbate our oral health and vice versa. And this is just a great graphic that represents how these different physical health indicators and aspects of our total health can influence and impact physically, but also frankly financially, which we will talk about that impact as well relative to our oral health. We can go to the next slide. So this is some information from TRICARE here. And what I want to highlight is that when we're talking about overall health, we include that to mean mental health. Just like other chronic health conditions, we know that mental health conditions affect oral health in multiple ways. And when providers and public health professionals connect the dots between those connections, we can then address them through integrated care, through collaborative action. So if we're looking at this here, we know obviously depression isn't the only mental health issue, but that looking at that specifically can really kind of have two impact pieces. It can, one, cause folks to neglect oral health if they aren't able to motivate themselves or do daily tasks like brushing teeth, etc. But then it also can impact seeking out unhealthy habits. So eating or drinking sugary or carb heavy foods, smoking, drinking alcohol, dental phobia and anxiety can be a piece. And then we also know that medical care, that antidepressant medication can have side effects that can impact oral health. So we really see multiple intersection points here and the need for an understanding of how these pieces interact, and for providers on both sides to be aware and kind of collaborate here. We can go to the next slide. And this is looking at some of our national data when we're talking about other chronic diseases. So this is just looking at kind of, again, that relation between chronic disease and oral health. So when we did a national overview after controlling for factors like income, education, and morality, we saw that veterans with diabetes are about 40% more likely to be edentulous than veterans without diabetes. And if we go to the next slide, we see a similar piece controlling for the same factors. Veterans with heart disease are about 30% more likely to be edentulous than veterans without heart disease. So we really see the intersection there of oral health outcomes with chronic disease and the need for that integrated care, complex care management. We can go to the next slide. So similar to our other graphs, veterans here are in blue and non-veterans are in green. And again, we see the pattern reflected when we're looking at prevalence of diabetes with veterans versus non-veterans, and then in rural veterans versus urban veterans that we saw in some of our other graphs of kind of those poorer outcomes for veterans, and particularly rural veterans. We can head to our next slide. And this graph is really showing us that veterans are not feeling as physically well as non-veterans. So again, with those veterans being in blue and looking at their self-reported physical health ratings by veteran status, they're lower on those excellent to very good pieces, and then higher when we're looking at fair and poorer. So we're just again, unfortunately, seeing this pattern repeat through our graphs and looking at different factors. So taking this information that we know and see about physical health and chronic disease in Iowa veterans, and taking that same kind of a data analysis to look at healthcare costs, impact, and potential cost saving solutions for veterans in Iowa, we want to highlight a few different call outs from the report. Again, recognizing that veterans are paying more out of pocket compared to non-veterans, and veterans are experiencing chronic disease conditions at a higher rate compared to non-veterans, and that veterans are unable to access dental care in this in the integrated care system through the VA. So if those things were to be resolved, if we were able to give veterans integrated care treatments in these systems where we're managing chronic disease conditions and oral health conditions in the same place, we can actually save millions of dollars, up to $100 million of those medical cost savings through more effectively managed dental care. So these graphics here are dispersed throughout the report and just really highlighting that piece of how that cost saving interacts to the veterans themselves, as well as the overall healthcare system and state system that we're looking at. We have more details in the report, and also we can answer questions about that. So we covered several aspects of oral health and physical health. And now we want to take a look at these graphics, kind of highlighting the pieces that we just touched upon as entry points for collaborative action and thinking through potential community partnerships for your programming. So that mental health piece we talked about, kind of connecting those dots, the housing insecurity piece, the transportation piece, kind of thinking through if you're developing out programming or advocacy planning, those different community partners you may want to consider to solve those problems. So we're going to head to the next slide here and take a moment to hear from all of you. How do you partner with organizations throughout Iowa to support veterans? So if you have a success story of making these collaborative action points, of working with other types of service providers, other types of clinicians, we would love to hear that. If it's not an actual story that's success yet, but something you're planning or something you are thinking of, or even just something that has been sparked on this call, we would love to hear any of those pieces of where you see those partnership opportunities. And we can head to the next slide. And we're going to go into some strategic recommendations. And Sam, as you're seeing stuff pop up in the chat, will you chime in? Okay, great. Thank you. Okay, we can head to the next slide. So one first place for collaborative action is advocating for VA dental eligibility expansion. So about 85% of veterans are not eligible for dental services through the VA, which means our Iowa veterans are struggling with a fragmented dental system with too many barriers to accessing dental care. That's the long story short of what we've been talking about here today. And as the largest integrated healthcare system in the nation, the VA is best positioned to support the complex healthcare needs for veterans. So advocating for that VA dental eligibility expansion can really address this problem in a multifaceted way. But VA expansion of eligibility requires legislative change. So what I want to highlight here is that when we're planning advocacy programs and plans, collaborative action and voice is required. It takes collective voice and perspective to have a successful advocacy campaign. So what that can look like is firsthand stories with veterans paired with data like this report. Again, we tried to build this out in a way that was really usable. So if y'all are doing things like an advocacy work, that you can take these sheets, you can take that 2-page executive summary to policymakers, decision makers that you're working with, and have a visually appealing, easily understand data right there up front without asking someone who doesn't have the time to read a very long report. So again, kind of partnering those pieces, firsthand stories with data from a report like this, as well as with oral health experts or public health professionals to lend expertise and reinforce the data. So that's our suggested approach. And again, as y'all are kind of thinking through the last discussion questions, if you have thoughts on this piece as well, or questions or examples that you've done, please feel free to add that in. We can head to the next slide. So consider forming a coalition of veteran oral health advocates. A coalition can be a key part of making collaborative action happen, and serving as a collecting body of bringing those stakeholders together. Again, if we're kind of planning those advocacy pieces, having a coalition that brings those different voices together can be really effective. And then once it's established, a coalition can be a really powerful platform. We are culminating these virtual community forums and an in-person statewide summit in August, on August 13th in Des Moines. So if this is something of interest to you, we're taking the feedback we have on these community forums to really form the agenda for that in-person session. And we'll really be taking kind of a day-long planning session to work through next steps of Iowa. And if a coalition is something that you're interested in, I highly encourage you to get that information. We'll share it at the end of this, and come join us in Des Moines, and we can work on next steps on working towards a coalition. We can go to the next steps. So I think I kind of hinted to this when we were talking before, ensuring veteran patient representation in dental associations and initiatives, collaboratives, etc. So in any of these pieces that you're doing, community voice is imperative. The folks, the community that we're working to serve are the folks who understand the nuances and the details of the broader barriers we've discussed here today, and can really have that lived experience. Again, example being of why is transportation an issue? That can be really nuanced and speaking to the folks on the ground, or even specific to the county of where there might be different answers at different points of the state. And they can really leverage their lived experience to bring viable solutions to the table that other folks might not see or be able to understand or know that it would be a solution to that nuanced piece of a barrier. So we can head to the next slide. Another option is developing community-driven educational campaigns for oral health literacy. So we also noted this. I know someone had brought up health literacy earlier in the chat, and if you want to chime in with any pieces of feedback or thoughts you have there, please jump in. We know from our stakeholder interviews that oral health education and health literacy is a main concern, and also that education is a key to prevention. So successful education materials and campaigns specific to Iowa veterans can increase prevention efforts. And I would also say that, when we're looking at these broad steps to make really big change, it can feel overwhelming or like it's really hard to get from A to Z. And this piece here, developing the educational campaigns and working, is kind of maybe one of those smaller steps. It might be a CD step that gets us on the pathway to Z of advancing veteran oral health care. So we hope that we provide a variety of things here that people feel are achievable, and that they can take steps on. Sam, I'm going to pause. Is there anything that we need to share from the chat before I keep going?
Not yet.
Okay. All right, great. Well, I encourage everyone to keep typing, keep thinking, keep asking questions. Okay. We can head to the next slide. Okay. And the other piece is considering non-traditional stakeholder collaboration. So again, we've talked about here, and kind of when we were looking at the oral health and the physical health, we really highlighted other healthcare professionals, service providers, public health services for partnership when we're talking about overall health intersecting with oral health. But we also encourage you to think outside the box when thinking about collaborative action and potential community partners. There's many opportunities to advance veteran oral health by partnering with businesses or educational institutions, insurers, faith communities, etc. Some of those pieces, like faith communities, might be a pathway to ensuring community voice, to accessing veterans, and having them be part of your programming or your coalition. Other places might be options for areas of expertise, educational institutions. For example, if you want to pursue a research option, that's a great pathway to having a partner who might understand that expertise area if you're not yourself a researcher. So really thinking outside of the box and understanding what additional voices you need at the table can lead to some really successful and innovative solution finding. So we are going to hear from you. I think maybe this is our last poll, but we want to hear what of these recommendations that we just listed are most actionable for you.
Poll is launched.
Okay, fantastic. Thank you, Sam.
Okay, no responses yet.
Okay.
I'll let you know when they come in.
Okay, great. We can go to the next slide then. And you can shape veteran oral health in Iowa, and here is how, some next steps folks can take. So again, kind of reflecting these pieces that we just talked about. Advocacy, educating stakeholders, making decisions, and seeking funding. And again, our hope here is that this report can really be a tool for any of these pieces that you're doing. If you're speaking to a decision maker and need, again, that 2-pager upfront visual information, it's there and prepped for you. If you're developing out some of those health literacy campaigns, using the more in-depth information to inform that content, hopefully it can reduce some of that barrier and make it a lower capacity project for everyone. Seeking funding, if you're doing grant requests and writing, again, pulling this data to support your LOI or your grant proposal. We're hoping that that's an easy tool, and again, takes the capacity piece off, puts the data easily accessible in your hands so that you can achieve some of these next steps. Sam, go ahead. Yes, share.
Hey, we've got our poll results. I will end the poll and share. Looks like 50% are saying they would advocate for VA dental eligibility expansion, 17% at ensuring veteran patient representation in dental associations and initiatives, and another 17% non-traditional stakeholder collaboration. So thank you, everybody.
Okay, great. Yes, thank you. And I will say that's going to directly inform our agenda at our in-person summit, which is actually our next slide here. So we will use that information to shape how much time we're allotting to each piece, what we're focusing on, what we're talking about at this in-person summit. We are launching registration for this at the end of the week. We have been collecting folks who are interested via an interest form. So if you're on this call and you filled that out, we will email you the registration. Sam will send a follow-up email to all registrants. So if someone registered and wasn't able to attend in person live here, she'll email out that recording. She'll email out the registration information. So stay tuned. Join us. And if you have any thoughts and questions, please share it with us. You can come off mute and share that now. You can pop it in the chat, or you're welcome to email us and share any thoughts or questions you have about that in-person summit. Okay, we can head to the next slide. Okay, so what are our next steps? So as Sam said at the top of this call, we have CEUs available for this session today. We're going to pop that link in the chat. So attached to the CEU request is an evaluation for today's summary, our session, excuse me. Our evaluations are really important. We use them to inform, again, the summit agenda as well as our next community forum. So even if you aren't interested or need a CEU for today's session, please fill out that evaluation and let us know what you think, and we will adjust as needed. Again, we talked about the summit interest form. We can pop that in. We'll be emailing out the registration form. The recording of this session, as well as a summary, will be up on that Iowa Veteran Oral Health page that we highlighted at the beginning, and we'll email that recording out to all registrants as well. And we have the last of our 4 virtual community forums coming up, and I think we have a registration link for that too that we can share. That can also be found on our website. And so that brings us to the end. I'm going to pause for a second and just check in, Sam, and see if there's any final thoughts or questions in the chat that we want to highlight before we're done with our time here together today.
Nothing further from the chat. I will email that link for our next community forum as well.
Okay, perfect. Well, thank you again, everyone, for being here with us today and for your dedication to veteran oral health in Iowa. And we'll talk soon. We look forward to seeing you on the next forum, and we look forward to seeing you in Des Moines later this summer. So take care, everyone.